Today I want to share with you the topic entitled, or the presentation entitled, Gum Disease, a silent path or pathway to heart attack and stroke. You see, every year millions of people around the world suffer heart attacks and strokes, the leading cause of death globally, unfortunately. But what if one of the hidden triggers begins not in the heart but in the mouth? You see, the shocking part is that the same bacteria that live in the gum can enter the bloodstream, travel through the body, and contribute to the formation of clots that can block the arteries in the heart and in the brain. So something that quietly starts in the gum can become a silent pathway to heart attack and stroke. You see, so when you say gum disease, what is it? Gum disease is medically termed periodontal disease or periodontitis. You see, periodontitis, it means that a chronic infection or inflammation of the tissue that support the teeth. It affects the gums. It affects the connective tissue. What are connective tissue? The body's natural glue. So with any glue there will be damaged by this gum disease. It also damages the bone that hold the teeth in place. But how does it start? Gum disease usually begins as gingivitis. What is it? It's early inflammation of the gum. At this stage, the gum may appear red or swollen and bleed when brushing off or flossing. So if gingivitis is not treated or reversed, it can then progress into periodontal disease or periodontitis. So the question is that if a person has periodontitis, what happens? The gum tissue pulls away from the teeth and forms periodontal pockets. It means spaces between the tooth and the gum. And this is quite damaging. These pockets become home for highly aggressive tissue invasive bacteria. They hide deep in the gum pockets in an environment without oxygen. This is exactly where they thrive and they multiply, and then they destroy the connective tissue, that natural glue, and eat away at the bone and enter the bloodstream, travel to the heart, and get pumped through the entire body, causing damage far beyond just the mouth. So what do? These aggressive bacteria who can go anywhere in the body because they create systemic inflammation. They can go to the joints. They can go anywhere. In fact, they can cross what they call the blood-brain barrier and cause neurodegenerative condition and cause stroke or cause cognitive decline. They can also, of course, cause stroke by causing systemic inflammation in the arteries and cause plaque buildup. And when this plaque cracks or bursts, clot forms, it swims. The first station goes to the brain and cause stroke. The second station is towards the heart and cause heart attack. But apart from this, the systemic inflammation or this bacteria can contribute or could be a risk for cancers and arthritis, specifically rheumatoid arthritis, which is connected with the immune system. Gum disease is very common in the world. In fact, research has shown that if you take two adults in the developed world, here in the UK or US, example, two adults, one of them may have gum disease. But the question is that how would you notice that you have gum disease? What are the symptoms? Bleeding gums when brushing or flossing, red or swollen gum. A healthy gum should look pale pink. Another sign is persistent bad breath. And then unfortunately people may be chewing gum, but the chewing gum contains aspartame, which is carcinogenic. So you don't just go there with chewing gum because you want to clear your mouth. Receding gum, the teeth may appear longer. Another sign is loose teeth, and then you may have pain when chewing, and that your teeth may feel sensitive. These are the signs to indicate that you have gum disease. So what really causes gum disease? Poor oral hygiene. People think that using hard brush is the way to go. No, using soft and using tongue scraper is the way to go, and avoid this regular toothpaste because they contain harsh detergent that create foam, but they irritate and damage the gum. They contain fluoride, which disrupt the thyroid and cause blood pressure and cardiovascular stress. The regular toothpaste may contain artificial sweetness and preservatives that may feed harmful bacteria, and they may also contain triglycerin, which is antibacterial chemical that kills both good and bad bacteria in the mouth. So you can be using that. You may also be taking high sugar or ultra-processed food that also contribute to gum disease. Smoking, diabetes may worsen your gum, and if you have gum disease, it's also worsen your gum disease. In fact, periodontitis or periodontal disease may also increase inflammation, which trigger production of cholesterol. So if you fix your gum disease, your cholesterol level may even come down. Chronic stress may weaken your immune system, giving a chance to opportunistic bacteria to jump into action in your mouth. Nutritional deficiencies like vitamin C, vitamin D3, plus K2, zinc, omega-3, if you're deficient, it can contribute to gum disease. But if you're on medications like antidepressant, blood pressure medications, antihistamine given in allergic condition, diuretics, that's water pills, painkillers, may all contribute to that, because dry mouth, all these medication will contribute to dry mouth. Dry mouth wouldn't help you. It will definitely lead to gum disease, because saliva is a defense system. It washes away bacteria and neutralizes acid. The normal pH in the mouth is 2.2 to 2.4. So if you have dry mouth, it will be acidic in your mouth. So let's look at the food that we need to eat to support the gum. The food that actually contain vitamin C, like bell pepper, oranges, guava, kiwi, they're really useful. Omega-3, we go for salmon, sardines, flaxseed, chia seeds. We look for green tea. They are strong antioxidants. We look for these crunchy vegetables, carrots, celery, apples. They are really good. Also look for this prebiotic food like garlic, onions, and banana. They are also very, very, very useful. So you see, gum disease is not just a problem of the mouth. It's a chronic infection that influences the health of the whole body, and it causes diseases, not only heart attack and stroke, but also brain disorders and even some cancers and arthritis. If you have gum disease, reach out on this number. It's +44 738 464 7300. If you are interested in what we're doing and you want to be part of this mission, go to my YouTube channel, put in Dr. James Naturally, subscribe to be part of this history and mission.